Hi, Austin Lawrence here from Get Your Back on Track. Today I'm going to talk about anterior pelvic tilt. Anterior pelvic tilt is the most common dysfunction I see around the spine and pelvis with people suffering with back pain. Due to muscle imbalances between opposing muscle groups, the pelvis tilts forwards and leads to pain and dysfunction. Some muscles will cause it to happen, whilst the opposing muscles will allow it to happen. Tight hip flexors, such as a TFL, which is a small muscle on the outside of your hip, rectus femoris, one of the quad muscles on the front of your thigh, and possibly psoas, a muscle that attaches to your lumbar spine and goes deeper into the groin, can cause it. There's other muscles that can indirectly contribute as well, such as the groin muscles. I say possibly psoas because psoas can be tight and strong, but it can also be tight and weak. Generally speaking, a tight muscle needs stretching, but psoas is also a spinal stabilizer, and if it's weak, the nervous system holds it in a shortened position so as not to lose spinal stability. You don't want to stretch a weak psoas. Some muscles allow it to happen. Weak glutes, weak hamstrings, and weak abdominals. These muscles become inhibited and put on stretch. The joints of the lumbar spine, or the facet joints, they move closer together and become compressed. This causes further pain and dysfunction. More pain causes more inhibition, as the nerves that come from the lower segments of the lumbar spine and the upper segments of the sacrum supply the glutes. Compression in this area caused by the anterior tilt leads to further weakness in the glute muscles. The hip joints are also affected. As the pelvis tilts forwards, the hips become compressed superiorly, they glide up slightly, and the femur is also allowed to glide forward slightly due to glutes being weak. The glutes are the only muscles that exert a posterior or a backward pull on the femur. When the glutes are weak, the head of the femur can glide forward slightly in the hip joint. This results in the hips becoming less mobile, and when you lose hip mobility, the body compensates by making up for this mobility at the lumbar spine, and this results in further pain because the lumbar spine is meant for stability. The day-to-day effect of this is pain, of course. Movements that require hip extension or moving the hip back, such as walking, are altered. If you're to walk a mile, you take approximately 2,000 steps, and if the glutes are not doing their job properly, the low back muscles have to take up the slack, so they're the prime mover, or they're doing most of the work in hip extension. So if you walk a mile and take approximately 2,000 steps, the low back has to pretty much do 2,000 mini reps during a mile walk, and that's a heck of a lot. You also see functional movements like a squat. You see that people they don't move through their hips properly, and they extend their low backs to make up for this lack of range of motion, further causing pain. What can be done to correct it? It's pretty simple and straightforward. You need to inhibit the tight muscles, and you can do that by static stretching. You need to activate or strengthen the weak muscles, and to do this you can use static holds in exercises such as clamshells and glute bridges. Finally, you need to carry this over into functional exercise such as squats or lunges. It's all well and good activating the glutes using clamshells and glute bridges, but they're all floor based. You need to carry these over into functional movements for it to be fully effective in correcting the anterior tilt. So that's anterior tilt, why it happens, what the consequences are, and what you can do about it.